This week, we're going to learn about the TMJ. TMJ also stands for temporomandibular joint. So here we see an example of someone who has pain in the TMJ, and you'll see a lot of clients that do complain about TMJ pain. And this is pain right over here when someone were to open their jaw or close their jaw, this joint gets used significantly. So there is a video that I have also posted on Blackboard, and it's right here, and this video explains everything that I'm going to talk about in this lecture. It's only a 3-minute video that I do encourage you to watch. Let's analyze the TMJ joint. So this is the temporomandibular joint, and the reason why it got this name is because temporal comes from the temporal bone. It's also where the temporal or temporalis muscle is, and then mandible comes from the mandible bone, which is right over here, and this is the masseter muscle. So temporomandibular bone is right here. The temporal bone and mandibular bone, they meet over here and they form a joint, and this joint is the most heavily used joint in the body because we're always opening and closing our jaw. Now when you look at the temporomandibular joint in detail, you'll notice that this is the temporal bone. This is the mandibular condyle. So remember, this over here is the condyle at the very end. And right in between here is the disc. And that disc is known as an articular disc, and it's basically a small fibrous pad that is between the bones of the TMJ. And it's there to provide support. If the condyle was rubbing against the temporal bone, it would be very painful. That disc over there provides some relief, provides some flexibility, provides some comfort. And when we look further in, what we're going to notice is here is the disc, and then there are something called synovial cavity. And that synovial cavity is filled with synovial fluid. And so basically there's fluid between the disc, which is excellent because it allows these two surfaces, so allows the condyle and the temporal bone to rub without irritation. So this is a joint that is used heavily, and it is rubbed without, or it is moved without irritation because of these synovial cavities and the disc. So let's look at some further terms. So there's something called the articular eminence, and that's just a bone that is right in front or anterior to the articular fossa or condyle. And you can see it's in front of it. So if I go back over here, this depression that we're looking at here, this concave thing that we're looking at here, is known as a mandibular fossa. It is also known as an articular fossa. And typically the condyle rests just underneath, inferior to the articular fossa or the mandibular fossa. Sometimes when there are TMJ issues that can happen, the condyle moves forward and hits the articular eminence. So sometimes it can go forward, and we're going to look at examples of that later on. But for the purpose of this class, I do want you to know that this depression is the mandibular fossa. Okay, and this over here is the condyle. Let's look at it more carefully. This is a temporal bone. This is the condyle bone. If you look at this depression right over here, that depression is known as a mandibular fossa. Okay, fossa is like a depression. And here is the disc that we're familiar with. And then we have a synovial cavity over here and a synovial cavity over here. And what you'll notice over here is that we have two synovial cavities, not one, two. So one upper and one lower. Okay, and the reason why it's there is to prevent the bones from rubbing against each other. We need that gap, we need that cushion. So it helps with support and prevents irritation. Now, when we look at the type of movement the TMJ has, there are two. There's rotational and gliding. And that video that you looked at earlier demonstrated this. So rotational movement is when you just open your mouth ever so slightly and this hinge kind of rotates or kind of goes down. So when the TMJ or when the jaw goes down ever so slightly, like 20 millimeters or less, that is considered rotational because this is just rotationally moving. Gliding is when the condyle glides down towards the articular eminence. So the condyle was supposed to be here and it went down. It glided down. Some people call it transitional. It's gliding down. Okay, so rotational is when you just open the mouth ever so slightly, so 20 millimeters or less. Gliding is when you open it fully, so see how the mouth is completely open over here, the jaw is widely open, and so now you have glided the mandible down. Okay, so rotational and gliding are two movements that you should know. Now, TMJ pain is common. Many clients you'll see will complain of pain in the TMJ, and one thing to note is that perhaps the pain could be referred pain, and referred pain basically means that it's actually not TMJ pain, but it could be ear pain, but it could be maybe muscle spasms. So your muscle of mastication, the muscles for chewing is working over hard, and that's the tenderness they're feeling and not necessarily the TMJ pain. It could be malocclusion. Malocclusion means when you're not biting properly, when your bite is off. So if your bite is off, that could cause pain here. So there are many reasons why someone might think that they have TMJ pain, but it could be other types of pain. So always check the radiograph, always palpate or feel around the area to check for pain. So one of the common things that people may say is that when they open their jaw, they hear a popping sound or a clicking sound, but there's no pain. There's no pain, but it just pops and clicks. And when that happens, what happens is that the disc, okay, so the disc that we were looking at earlier, gets pulled far too forward, gets pulled anteriorly. So typically the disc should be right over here, but if the disc gets pulled far forward, then it can create that popping and clicking sound. And so there are treatments for this, but you do not need to know about the treatment for this class. Grinding. So grinding is very common. People grind at night where you just rub your teeth against each other, and sometimes, as you can see here, this person has been severely grinding that the teeth have kind of been grinded off. So there are ways to treat this, which we will look at. Another thing that is possible that could happen is something called subluxation. And subluxation is when you open the jaw so much that, or when a person opens his mouth too wide and then they can't close it. Or if they close it, it pops. But basically, when you open your mouth way too wide and you can't close it. And when that happens, what happens is they would have to go to a dentist, and a dentist can manually just move the mandible to where it has to be. Okay, so subluxation is when a person opens their mouth too wide and then they cannot close it. Bruxism. So bruxism is a fancy word for grinding. So we looked at grinding earlier, where people are just rubbing their teeth against each other. So the max teeth and the man teeth get rubbed against each other, usually during sleep. And imagine this happening the whole time while you're sleeping. When you wake up, you're definitely going to have tenderness in the TMJ area, in the area where your temporomandibular joint is. So what you can do to treat that is you can get a night guard, a custom-made plastic night guard that a dentist can make, and it covers only the upper teeth. Okay, and when you do that, it eliminates the tenderness of, eliminates any wear on the teeth and any tenderness of the teeth from the stress of that joint. Another thing you can also do is, if you have a lot of tenderness in the TMJ, is that there are some medications that can help relax your muscles and relax your tension, and relieve the tension rather. Arthritis is another common thing that could happen in your TMJ. And if you look over here, this is an arthritis TMJ disc where the disc kind of looks broken down. So to treat this, there are some cortisone shots that can be given to the client that can relieve the arthritis, but pain will probably still be there.